Okay. So now this cyst ends up containing a thick, viscid fluid, which is just like chocolate
Today I
sauce.
plan
In
to
talk
talk
about chocolate cyst.
Yes.
This is something which is so prevalent. And the moment the scan report says chocolate cyst, people are actually quite puzzled. How can you call a cyst as chocolate cyst? So today I wish to talk about this paradox. I would like to call this a paradox because this comes as a part and parcel of the spectrum, the entire spectrum of what endometriosis can do to a woman's reproductive system.
Amazing.
So last time we discussed that endometriosis is the right tissue at the wrong place. Today I'm going to talk about what happens if this tissue is in the ovary. Okay. So endometrium is the inner lining of the uterus, which is responsive to the cyclical hormonal changes that happens in the woman's body. So when her ovaries are making estrogen, when the follicles are growing, estrogen is made, and this estrogen makes the endometrium, the lining of the uterus, grow in thickness. Okay. So when the follicle becomes big enough, ready enough, it ruptures, releasing the egg, which was formerly inside it. After the egg is released, now this follicle becomes a factory of hormone production. And now this comes to be called as corpus luteum. So this corpus luteum now, in addition to making estrogen, makes progesterone as well, which matures the endometrium and which prepares the endometrium to receive the fertilized egg, if at all fertilization happens, to start pregnancy. Now, this structure called corpus luteum has a fixed life.
Okay.
This remains functional for up to 12 to 14 days from the time of ovulation. So, if pregnancy happens, the pregnancy hormone that forms from the conceptus, HCG, does not allow corpus luteum to die out. In the absence of pregnancy, because there is no HCG hormone, it continues till the time that it is destined to, which, as I just said, 12 to 14 days, and then it breaks down. With the breakdown of corpus luteum, the hormone supply, the estrogen and progesterone, it falls rapidly. So now the endometrium is left bereft of estrogen and progesterone, which makes the endometrium shed. Now endometrium is like a building without the foundation. So it can't sustain itself without the hormonal support. So it breaks down. So when this tissue breaks down, bleeding happens, and this debris, along with blood, it comes out of the body through the natural passage of the cervical canal and the vagina. So this is called the menstrual blood. Now, because this cycle happens every month cyclically, because of the involvement of the ovary, ovary has a boss called pituitary. Pituitary is a small gland in our brain. Pituitary also has a boss called hypothalamus. So menstrual cycle is the interplay between this subordinate ovary, the boss pituitary, and the superboss hypothalamus, all of them playing an orchestra to the uterus. Okay. So this endometriotic tissue, if it is outside of the uterus, because by nature it is endometrium, it will respond to the same hormonal cycle. Okay. Now uterus has an outlet to allow the debris and the blood to pass out of the body.
Yes.
Inside the ovary, if this endometrial tissue becomes embedded, okay, this tissue is again going to follow the pattern of growth, maturation, and shedding. But here is the difference: there is no place for escape.
Yes.
So it keeps on accumulating as a cyst inside the cyst. Now, if you might have noticed, blood is something which, when it is fresh, it is bright red in color. As the oxygen levels fall, it becomes darker and darker. Okay. But this debris and blood, when it becomes old, it becomes dark maroon to brown, which looks exactly like, pardon me for saying this, chocolate sauce. Okay. So now this cyst ends up containing a thick, viscid fluid, which is just like chocolate sauce in color. That is why this cyst now comes to be called as chocolate cyst. Now, this cyst, while we do the scan, has a very distinct appearance, which is which looks quite different from a routine follicular functional cyst or a routine follicular corpus luteum cyst. In essence, it looks different than the functional cyst that we see in ovaries.
How?
Okay. The functional cyst, the corpus luteum cyst or even follicular cyst, has a very sharp, thin-walled margin. And the content of the cyst is uniformly dark. In radiological parlance, we have this terminology called anechoic. It looks dark black. The contents of the chocolate cyst looks gray.
Okay.
It is neither bright, it is neither dark, it is something between it. So it looks like, a ground glass. We all know what a ground glass is. It is a glass which we must have seen it in buildings. There is a glass, it allows the light to pass, but it doesn't allow the exact image to pass. It is translucent. Okay. So that kind of a cyst on scan looks like ground glass appearance.
Okay.
And endometriotic cyst, the chocolate cyst, is in comparison to a functional cyst has a thicker wall. So it has a thick wall with a content which looks, somewhere midway between hyperechoic and anechoic, which to a person who is doing the scan looks like, uh, we call it mixed echogenicity, but to address to a forum where medical knowledge might be limited, I would call the appearance as midway between the two extremes. Okay, grayscale. So that is why this cyst is quite difficult to miss. And this endometriotic cyst, chocolate cyst, eats away into the tissue of the ovary, depleting the ovarian reserve. Ovarian reserve means the balance number of eggs left behind in a woman's ovary during any time in her life. It is just like the balance, the balance of her eggs. Just like we have a passbook or the bank statement to tell us what is the cash available in our account. Ovarian reserve means the rough number, the estimate of the eggs remaining in our ovaries. So endometriotic cyst eats away into this reserve, depleting it faster for age. With age, all of us suffer this decay, but endometriotic cyst makes it faster. It hastens this process. That is why endometriosis depletes the ovarian reserve. Not only this, any surgery to remove the endometriotic cyst from the ovary will also do the same thing, because when we take out the cyst, along with the cyst wall, the normal ovarian tissue is also taken out.
Okay.
Some amount of normal tissue is sheared off along with the cyst wall. So what is the end result? The damage that the endometriotic cyst, which has already happened. In addition to that, during the process of removal, some part of the normal ovarian tissue, which contains the egg with it, also gets shorn off. So the end result is the woman is left behind. I understand that now the cyst is gone, but along with it, some part of her eggs are also gone. So
Ah,
any surgery to take out the endometriotic cyst eventually is likely to lead to a fall in her ovarian reserve.
okay.
So any woman who undergoes a laparoscopy to remove endometriotic cyst must be warned that after this procedure, there is a good chance that your ovarian reserve may fall, and whether it will recover or not, only time will tell. Normally, there is a biochemical in our body called AMH, anti-Mullerian hormone, which we measure, which gives us a rough estimate about the ovarian reserve. We have observed that any woman who has undergone a surgery to remove chocolate cyst from the ovary has a fall in AMH in 3 months post surgery.
Okay.
So that is why this is a double-edged sword, whether to keep it or to get it removed. Now let's talk about the first scenario. What happens if I choose not to have it operated? Endometriosis is a progressive condition. So even if I remove a chocolate cyst, there is always a chance that it can recur.
Yes.
So once I remove it, there is no guarantee that I'm free of disease. And endometriotic cyst is just one of the many variants in which endometriosis can present. And as we discussed during our last session, the magnitude of symptom, the pain, is never a true measure of the severity of disease.
Yes.
So a lady who might have chocolate cysts, big ones in both the ovaries, may be absolutely pain-free. And a lady who does not have a chocolate cyst, who just has a surface lesion of endometriosis, can be having excruciating pain during her periods and while she has intercourse.
Mm.
So if a woman who is known to have a chocolate cyst decides not to undergo surgery, what all can happen? Number one, the cyst will grow. Usually this cyst, I have seen this growing fast. I have seen this growing not so fast also.
Mm.
But whether it is growing fast or slow, the impact on the fertility is going to be real. Okay. So this is number one. Number two, when this cyst grows, now this grows in between the tissue planes between any two organs.
Mm.
The organs that are there in our pelvis, in a woman, urinary bladder, the uterus, the cervix, the vagina, the ovary, the fallopian tube, and the back passage, the lower end of the intestine.
Mm.
Okay. When I talk about intestine, there are three distinct segments that we talk of: the sigmoid colon, the rectum, and the anal canal. Now, during our last session, I briefly talked about rectovaginal endometriosis. We call it deep infiltrating endometriosis.
Yeah. And how
Okay.
no
Now,
bonds?
yes. Now, any of these organs or all of these organs, because human pelvis is a small space in which so many organs are there.
Mm.
So there is a bit of crowding. So any tissue plane between any of two organs, if chocolate cyst appears, it is going to involve the walls of both the organs.
Okay.
The
Wow.
end result being all these tissues now getting stuck to each other,
Mm.
and the same disease process affecting the adjacent organ as well.
Mm.
Okay. So whichever organ is now affected by endometriosis starts manifesting the symptom of that particular organ as well.
Okay. Wow.
For example, if it is the urinary bladder, then during the time of menses, there is a good chance that the woman starts bleeding in her urine.
Okay.
Why? Because now the endometriotic tissue, endometrium, the ectopic endometrial tissue, is now present in the wall of urinary bladder, which erodes into the inside. So anytime that it sheds, when the woman is having period, the ectopic endometrium is also going to shed. But now it also has a way out, which is through the urinary bladder.
Yes.
Okay, so along with the urine, she will notice that she is passing blood. Passage of urine itself might become painful.
Okay.
She may have urgency while passing urine. Okay, the thickness of the bladder wall, the urinary bladder has a particular thickness. That bladder wall now becomes thickened. So this can give rise to frequent urination, thickening of the bladder wall. Normally in women, urinary tract infections are very common.
Yes. Yes.
So any woman who has endometriosis, who may have symptoms of urinary tract infection, actually may not have urinary tract infection. She may be having endometriosis of the urinary bladder also. So this is the effect of endometriosis in the forward compartment, because just in front of the uterus is the urinary bladder. Now I talk about the compartment which lies behind the uterus, which is the back passage, the intestines. Okay, so any endometriosis that affects the intestinal wall, if it erodes into the cavity of the intestine, just like the urinary bladder, the woman may pass blood along with her feces whenever she menstruates. So blood in stools, diarrhea, pain, all these symptoms.